and that's where we are now. Probably by tomorrow, something more will come.
Well, definitely, we'll be reaching out to you tomorrow. Hopefully, we will have more developments on that issue. Betty, thank you very much for joining us on Network Africa.
Thank you.
Well, we'll take a break now on Network Africa. When we come back, we look at another health issue in Kenya. It's about autism in the country. Please stay with us. Back to Network Africa. Now, a new U.S. study indicates that 1 in 68 children worldwide is autistic. In Kenya, autistic children and their families are lobbying for better laws and support to overcome stigma and a lack of awareness. Our colleague at the Voice of America, Lenny Ruvaga, reports from Nairobi.
These are the Manyaras. Today, Grace Manyara is escorting her son, 23-year-old John Manyara, to work. John is autistic, a developmental disability that can cause significant social, communication, and behavioral challenges. Autospectrum disorder, ASD, affects 1 in 68 children worldwide, according to the United States Centers for Disease Control and Prevention, CDC. In Kenya, statistics haven't been quantified on the number of those affected by the disability. John is one of the few autistic youths in Kenya who engage in gainful employment. He works at Karatasi Yahewa Safi, or Kahesa, which when translated means eco-friendly paper. 3 years ago, Simia Ahmadi began Kahesa with her personal savings of $12,000. Her staff makes handmade paper from banana bark and rice husks, which she then sells at exhibitions, schools, and trade fairs. On average, Kahesa makes approximately $500 a month, which is then used to pay the workers and buy materials. Ahmadi began Kahesa with the sole aim of generating income for young adults with mental challenges.
I hope that after 2015, they will be integrated into a regular professional field so that they are now included in the workforce and not isolated. Because once they have the vocational training here, they should not stop at that. They must fly with their own wings afterwards.
Grace Manyara runs a cyber cafe in Nairobi. For 10 years, she struggled with the lack of awareness in how to manage autism. According to her, stigma is the biggest challenge that is yet to be overcome.
It's a hidden disability, so there's nothing to show that he has a disability. So there's a lot of stigma. There are others who think that the child is bewitched, kurogwa in our language, and which is not the case. It's a manageable disability if it is handled well.
James Karanja is the founder of the Autism Support Center Kenya. He notes that the government has neglected the plight of those with autism and should do more to reduce the stigma attached to autism.
We need increased funding to institutions that offer training for persons working with those on the autism spectrum. And these are the teachers, specialized teachers, medical personnel, we need therapists, and also bringing more awareness. So it's actually the government who should be at the forefront to bring more awareness so that the stigma and all these other issues affecting those with autism are reduced.
Although the Kenyan government cares for the disabled through the National Disability Fund, those with autism aren't looked after as closely as they should be. It is hoped that with more pressure from lobbying, the Kenyan government will accord ASD the strengthened policy and interventions it deserves.
And you continue to make friends.
Now, we've looked at how it's been handled in Kenya, the issue of autism in terms of addressing the stigma. But now we're going to look at how it's being handled right here in Nigeria. And joining us via Skype is Okey Martins, who is the coordinator for the Center for Autism and Developmental Disabilities. Okay, thank you so much for joining us on Network Africa.
Thank you, my pleasure.
Now, can you give us an idea of how much awareness there is concerning autism in Nigeria?
Well, there has been a lot of improvements in the past few years, especially in the city, like Lagos. A lot of awareness is coming up, but across the country, there is still a whole lot of, misunderstandings about autism, what it means, and how it affects people.
Could you also give us an idea of the challenges which they encounter? From what we heard from Kenya, we know that there are challenges concerning getting jobs, for instance, for people who suffer from autism. But could you give us a broader idea of what the challenges those with autism face?
Well, you know, by definition, autism itself is a pervasive developmental disability. And this implies also that its impact cuts across different trajectories of development. The big issue and challenge is with access. And this will be access to all the range of services and support systems that people with autism require. A person with autism generally would have severe difficulties or significant difficulties in the area of language and communication, in behavior, as well as in their social interaction. And of course, sensory issues are present as well. So the implication of this pervasiveness is that people with autism would need services across these multi-professional areas. And for us in Nigeria, the big challenge is access to these professionals.
What about stigma?
Yes, stigma is a very huge issue as well, because people with autism are stigmatized. And I think a lot of that is also with the level of awareness, because what you don't know, you tend to misunderstand. And people with autism are stereotyped, they're stigmatized, and even in places like some parts of Lagos, have described people with autism as possessed by demons, you know, and this is untrue. So I think awareness is going to help to deal with issues of stigma, of course, yeah.
So besides awareness, what more can be done to improve the situation?
Please, could you say that again?
Besides awareness, which you did mention, what more could be done to address the situation, to improve it?
Okay, yeah. After awareness will be action. And this action would imply action across, you know, from government to, you know, to educational institutions and society in general. People with autism need to be accepted and included in all areas of life. And inclusion should be the next step after awareness. And, you know, but part of it also is creating opportunities for early detection and early intervention. And this is also an area that's lacking significantly in our country. Many of our children are not being picked up early enough. Oftentimes, the average age of diagnosis is usually around 7, 8, and that's not a good enough time.
Okay, Martins, it's been a pleasure having you join us on Network Africa. Thank you so much for your input. Thank you. Okay, Martins is the coordinator for the Center for Autism and Developmental Disabilities. Now, tomorrow we will be talking about the Democratic Republic of Congo, which has been urged to investigate at least 421 bodies found in an unmarked burial ground in the capital, Kinshasa. We'll be speaking to a representative of the Human Rights Watch, as they are also monitoring the case closely. But we'd like to hear from you here on Network Africa, and you can feel free to reach out to us either via email or Twitter. The address and handle are right there on your screen. As always, it's been a pleasure. Thank you so much. I'm Cynthia.